Hello everyone and welcome to today's episode of the Osasu Show. Today we bring you a very interesting interview with the former governor of Kano State, distinguished Senator Rabiu Musa Kwankwaso. As you may know, the Kwankwasia movement, which became popular in Kano State owing to his leadership, has gained solidarity both within and outside of the state. On today's episode of the show, our guest will be talking about his political journey, the rift between him and the sitting governor, and how this has deprived him from access to his constituency. He would also give us his assessment of the present administration and address rumors of his plans to run for president in 2019. Later on today's episode, we bring you an exclusive documentary from Abia State's health sector. The indigenes reveal their success stories with the initiatives put in place by His Excellency Governor Okezie Victor Ikpeazu. Don't go anywhere and we'll be right back on the Osasu Show. Your Excellency, Senator Rabiu Musa Kwankwaso, thank you so much for joining us in today's program.
Thank you, it's a pleasure.
So, can you give me your assessment of the present administration's achievements and work so far?
Well, let me start by thanking you for coming, and I also want to say that so far so good. The administration, of course, is doing its best. So also the party. But I hope the government and our party should do much more than what we have seen in the last 3 years or so. So that by the grace of God, in 2019, that is next year, the good people of this country can come out again and vote for our candidates from the councillorship right up to the position of president under the party. So that's my assessment for now.
Okay, so we've been to the streets, we've talked to everyday Nigerians, and most people we've spoken to disagree with your perspective that the present administration is faring well.
Well, of course, everybody has got his own way of assessing the situation, and everybody is entitled to his own opinion. And for me, one can say that yes, the government can do much better than we are seeing today on the ground. And that is why I say this last 1 year is very crucial for the party, for the government, and therefore for the country.
You were one of the 7 governors who decamped from the PDP to the APC. You formed the G7 movement, which was a very critical bloc in the emergence of President Muhammadu Buhari. Some of your supporters under the umbrella of Kwankwasia have claimed that you've been marginalized by your party and by and large the federal government. Do you agree with this notion?
Yes, we started the movement. In fact, 7 of us, as you mentioned, but actually at the end of the day, only 5 of us governors then that we decamped from the PDP to the APC. And as I said, the issue of marginalization, the issue of performance, I can tell you once again that the party and the government has still time, they still have time to improve. Yes, maybe they are right, but still there is time for the government and our party to do more, not only for me or members of Konkosia across the country, but of course for all those who came together to form the APC and the entire people of this country.
There are rumors that you are looking to decamp. A lot of Kwankosia's supporters are looking to decamp from the APC because, as I said earlier on in the interview, they believe that you haven't been treated fairly in your party. Is this rumor true?
The issue of decamping or leaving APC is not on the table now. We are looking at how the various stakeholders in our party will look at the situation, not only the situation in Kano, but there are many other places that something should be done.
You're a senator representing a constituency in Kano State. You haven't been back in 3 years, almost 4 years now. Indirectly, you're not able to do your job as a senator. You're meant to be in Abuja representing your people. But unfortunately, if you can't go to the field to feel the pulse of your people, then you're being hindered from being effective as a senator. So what's the solution to this rift between you and the present governor of your state?
If you are talking of Kano, the good people of Kano are very, very understanding. They do understand my circumstance. It's not, I didn't want to go to my constituency, but the last episode has shown beyond reasonable doubt that there are people who don't want me to go, but the people on the ground in my constituency, of course, want me to go there to see them, and of course, vice versa. So, of course, that we will do in the near future. But the issue of doing my job, I'm doing whatever I can from here. Of course, it would have been better if I had the opportunity to go there. And I'm very happy that my constituents, not only in the Kano Central, which coincidentally is the largest constituency in this country in terms of population, because I am going by my votes. There are almost 760,000 votes for my humble self. And we are working together, very good understanding, and I will continue to communicate the way we are doing pending the time that the IG and other stakeholders decided to say that I can go, I am safe to go.
The local government election in Kano State was just finished. We saw a high turnout of underage voters. What is the solution to stop underage voting, especially given the 2019 elections are in our horizon?
In all elections, there should be more than one party contesting. If you have more than one party, then party A will never allow party B to do any form of magu-magu, especially the issue of the people who are below 18. In 2019, if you go there, no child will go close to any ballot box or anywhere, because if you are coming to vote for a party, A, B will say, get out of this place. But those ones, I think they are invited to go and thumbprint, because the real people were not there. All the Konkosia you mentioned didn't go there. The PDP wasn't there, and nobody was there. Do
you believe that by 2019, INEC can fix this bottlenecks to ensure that we actually have a free and fair election?
It's not even INEC. It's not even INEC. The parties. If you see children voting for another party, you cannot keep quiet.
But this is not the first time we've seen underage
No,
voters.
this is the first time I've seen the type of thing that is happening.
At that level, but it's not the first time it actually has occurred in the system.
Well, this is the first time I can remember seeing only children on the queue, on the line, trying or voting or thumbprinting. In 2015, we had over 5 million registered voters in Kano. Over 5 million. If you go and add about 2 million for APC and so on, just less than 2.5 million, less than half, 50% of the registered voters, people didn't go out. Still, even at that time and at that level. So, anytime you deviate, anytime you decide not to do the right thing, of course, at the end of the day, you see all these things or these abnormalities happening in democracy.
My very last question, distinguished Senator, and I need a yes or no answer. Do you intend to run for president in 2019?
No, there are questions that require beyond yes or no, and I think this question is one of them. You see, we always tell our friends, we tell our brothers and sisters that first and foremost, people who understand democracy go into politics first and foremost as politicians. I joined SDP 1991 as a politician. Along the line, I contested and won an election. In 2003, I contested election to become a governor. After primary election, as a sitting governor, I lost election. In 2015, I contested primary election in Lagos in the APC. I lost election. You can see from 91 to date now, I contested 16 elections, primary, secondary, 16 times. I won 14 and lost 2. Now, even the 2 are very important to me, because anybody who is in this game of politics who never contested an election or contested and only won or only lost, to us is not yet complete. We can't call him a complete politician. We keep on moving. When the time comes, we look at ourselves. If we realize there is need to contest election. Now I'm a senator. I'm a very happy and contented politician. And we are in a political party as we are moving. I'm sure a decision will be made whether to contest, whether not to contest, whether to come back to Senate, whether to do anything. We'll come to that.
That's a fine place to leave it. Thank you so much for your time, distinguished Senator. To watch extended clips from this interview with Senator Rabiu Musa Kwankwaso, you can visit our website, tostvnetwork.com. Next up on the program after this short break, we'll bring you an exclusive documentary from Abia State. We'll be taking a look at the initiatives done by the present governor, Okezie Victor Ikpeazu, in the health sector. We have everyday Abians speaking to us about how these initiatives have bettered or impacted their lives. Don't go anywhere, and we'll be right back on the Osasu Show.
Abana kwaya kwa, abana do ya do. Iyo wole toro bia waba, abana no ya no. Abana kwaya kwa, abana do ya do. Iyo wole toro bia waba.
governor's vision for Abia, as far as it pertains to health, is to be able to deliver available, affordable, and accessible healthcare delivery system for all Abians and those who are resident here. The governor also intends that Abia should be a medical tourism destination. The aim is to improve our maternal mortality indices, improve on our infant mortality indices, and overall impact positively on the life expectancy. At the moment, you know, life expectancy in Nigeria is hovering between 53 and 55. It is our intention that some of the activities we will be doing in Abia State, especially in the healthcare delivery sector, would impact positively and up this particular figure. His Excellency the Governor, by dint of hard work and prudent management of resources, has been able to attract funding from funding agencies. And I am particularly talking about two that are currently ongoing in the state. The Saving 1 Million Lives Program for Results that is targeted at 6 thematic areas, and then the Basic Healthcare Provision Fund. Now, these two funds that we are assessing at the moment are going to impact at the primary healthcare level. He has introduced, obviously through the Ministry of Health, the care for the elderly people in our society. What we want to do for this age group, this particular age group, that is the 70s and above, is that we want to be able to offer them free medical care at primary health care level to complement the care for the elderly being provided by this group of specialists from the United States of America.
Ndị gọvanọ anyị zitara nyamaka ndị ụwa abịadoro wela kem ile m ahụ adịghị m ike adara m ada ji ọkpụ okwu a dị eme dịka ọ chọrọ ịnwụ m anwụ abịara obi ele m elekwa nna m mgbe adị wee rụọ ọrụ otu iji zie gọvanọ anyị bụ onye ukwu imeela jisi ike otu iji zipụta obodo eji wede arụ ọrụ obi ruru uwe ala adịghị wee ka anyị eji obi ọma da ajụ ajụjụ emekwa ihe si wee mee ka ọma ịgbalịela jisi ike Chineke nyere unu aka n'enyemaka unu dị inyere ndị ụwa ka hụ unu dị ime akara anụ unu biri m ahụ ajụtụla m oyi
Gọvanọ ndịrị anyị a na-asị anyị na onwe na chọrọ need hazi na ịbịa na-eleta ndị okenye so ya sị na anyị bịa na-aga n'ụlọ ka anyị na-eleta unu ahụ mara otu ọ dị unu anyị kwana unu mkpụrụ ọgwụ onwe onye nwere need ịhụ dọkịta anyị akpọkwa dọkịta ya ahụ ya so ọkwa na anyị si bịa anyị agakwala ọwụke ndị ka ọzọ so ọkwa na anti anyị si kpọrọta anyị because asị ka anyị bịa na-ahụta ndị na-akala nka from 70 years so ọkwa na anyị butere anyị n'ụlọ gbokwa na anyị chọrọ ịbịa leta gị ahụ mara ma BP gị ma shuga gị mara otu ọnụ ka anyị were makwa na ha ọzọ anyị ga-eme
Awum nọọsụ ihe anyị Esther ọwụ gọvanọ zitere anyị ka anyị bịa na-ele ndị na-akatala n'ahụ ọ sị anyị ka anyị bịa na-ele gị ka a mara otu unu si mere marakwa n'otu a ga-esi enyere unu aka
We are here for a program, the Tender Loving Care Home Care Services, designed by our amiable and health-loving governor. He designed it solely for the aged from 70 years and above, just to take care of them because most of them and some of them don't access healthcare facilities. They cannot even access health. And it was just a courtesy of our amiable governor because he cared. I know he cares so much because it's not easy to set up such thing because both the monetary aspects, even sponsorship and everything is not easy. So I want to give kudos to him because he has really tried.
Courtesy of our Governor, Dr. Okezi Ikpeazu, this is just to inform our Abians that we are here today in Isialambwa South. And all along they've been talking to nurses from Isialambwa South. There's a particular reason for that. We don't bring people from Arochukwu to come and work in Isialambwa South because of the culture, because of the people. Once they come in and start talking to the old man and the old lady or our elderly ones in their own language, is security conscious, they start to respond, they open up. When we went to Ukwa East, which we've established, the same thing happened. They just talk in their own native language. So everybody you see working here is from Isialambwa South. We'll finish that, we'll finish Obingwa, we'll be finishing Isialambwa South. When I say finish, that means we've established what is going on. The service continues. And so far, we've taken 40 patients in Ukwa East, 40 patients in Obingwa, 40 patients in Isialambwa South. That makes it 120 patient total. As we leave here now, we'll go for a conference. We'll sit down and divide all the patients into the caregivers so that the young man that we saw today, we'll be seeing them based on the plan. We'll have what we call a plan of care. Based on that plan, we'll decide if we're going to be seeing him twice a week, once a week, once a month. It just depends on his own disease process. So once we sit down and analyze all of that, we'll make that decision. Then he will see us coming.
We are looking at this, what I would call intensive care unit on wheels. It has everything to keep you alive from the point that they pick you up to when they deliver you to the next point of care. And clearly, accessing this service is through the dedicated number, and in this particular case, it is 112. Normally, what should happen is that you dial 112, it gets to the call center, you get triaged, they make the decision if it is important to send out this motorized equipment to you. And their brief will be, go there, make a decision there. When you're looking at the patient, is this patient alive? If this patient is alive, what next do you need to do for him? If it's a very simple thing, fine, handle discharge. But if it is not, then the onus falls on the operators who are very, very well trained.
What we do in Abia State Emergency Medical Services is a heart-breaking good event, which has made me as a nurse to feel that Abia State is going forward and Abia State is growing. When I was a student nurse, I watched a lot of movies on how people rescue victims, you know, how nurses work. And I felt like, can this kind of thing happen in Nigeria in any day? But to my greatest surprise, after some time, you know, we were called upon to come and receive trainings that such things is going to come to Nigeria, and to be precise, Abia State.
Finally, Abia is safe, and we are going towards delivering qualitative medical care for our populace that is, like I said earlier, available, affordable, and accessible.
That's it for today's episode of the Osasu Show. To watch this episode, you can visit our website, tostvnetwork.com. Don't forget to follow us on social media at the Osasu Show, at TOSTV Network, at Osasu Igbinedion on Instagram, Facebook, and Twitter. If you need the services of TOS TV Network to create jingles or documentaries, you can contact us by the email or the number on the screen. Don't forget our initiative, The People's Candidate, is still very much alive. We would want you to nominate who you want to be president in 2019 by going to tostvnetwork.com/TPC. I'll see you same time, same place next week. And until then, take very good care of yourself. God bless you.